Welcome back to Great Day Washington, continuing our series on National Family Caregivers Month. There are a few things you want to have in place, especially if you are new to the role. I spoke with the author of the book, Health Yourself, Janice M. Horowitz, to get some helpful medical tips that can simplify some of the most difficult parts of caregiving. Take a look. We're talking about caregiving, so if someone is new to a caregiving role, what advice would you give them when it comes to their health care?
Well, the idea is to minimize your own stress. And there are two things that you should do initially. They may be a little upsetting, but you've just got to hold your nose and get them done. And that is sign what's called a healthcare proxy. That allows your loved one to choose you, or maybe you and someone else, to make healthcare decisions when they are no longer able. So this is a great thing to reduce your stress because it focuses, in a sense, all the attention on you, and you don't have to deal with conflicting ideas and people screaming about what they want. And as a matter of fact, it also helps the doctor. As it turns out, these encounters in, let's say, a hospital room, when everybody is weighing in, has a name. They're called triad encounters. And there's a study out of Canada that shows that 81% of family physicians hate that and consider it the worst part of having a caretaker, which is having all these people weigh in. So be sure to have it signed on a piece of paper that you are the person responsible for decisions. And there's a second document that you just have to take care of, and that's called a living will. And this will help with the healthcare proxy. A living will is when your loved one states basically how far they'll go, how much help they need in their lives. Do they want to be resuscitated? Do they want extraordinary measures? Once you know that, it takes a lot of stress away for you. It provides guardrails to help you in the business of caretaking. So get those two documents squared away.
Janice, great information. As a former caregiver, you're absolutely right. Man, this is so invaluable. Now, what should caregivers consider when it comes to health insurance?
There's a big elephant in the room when it comes to insurance, and it's called Medicare. Doctors don't like to take on new patients with Medicare because the reimbursement is less. So if your loved one has a doctor who he or she really likes, ask if that doctor can continue with them past the age of 65 and use Medicare. And there's one kind of doctor actually who always takes Medicare, and those are called geriatricians. They only deal with the elderly. So if you can find a geriatrician in your area, go immediately, make an appointment and see if you like him or her. And geriatricians are great. They can recognize symptoms that a normally trained, an internist, may not recognize. For example, pneumonia in younger people always presents with a fever. If a doctor sees lung congestion and a fever, off they send a younger person for an X-ray. But in older people, your loved one could have pneumonia and not have fever. A geriatrician knows that, and a geriatrician always takes Medicare, so look for one.
Janice, as we wrap things up, why do you recommend that caregivers attend every doctor appointment for the person that they're caring for?
Well, you know, an elderly person has special vulnerabilities. He or she may be hard of hearing, may be a little muddled in their thinking, may not have the kind of fight left, right? And occasionally doctors can be a little dismissive of an older person. Sometimes they don't look at the person in the eye. They may treat them consciously or not in a slightly condescending way. So you should be there as a caretaker always, to be the advocate. In my book, Health Yourself, I have a lot of questions that you can go over. You should come to appointments with questions prepared, and you can discuss the questions with your loved one beforehand. And also, as maybe awkward as it might seem, come with a pen and pencil, ask the questions, and take notes. That way, you and your loved one can go over everything carefully afterwards, and you know that he or she is getting the best possible care.
Janice, thanks for sharing this amazing information. It really is life changing. Thanks again for joining us on Great Day Washington.
Thank you so much. Great to be here.